All right. Hello, guys. Back to Unit 2. Short one here. Thankfully, this is Chapter 18, discussing management of upper respiratory tract disorders. So, upper respiratory tract, again, it's an A&P reminder, is just the nasal cavity, the pharynx, which is just basically the back of your throat, where your nasal cavity meets everything, where your oral cavity meets the throat, and then just above the larynx, which is where your voice box is, just and also where the epiglottis is, the muscular connective tissue fold that will fold over here, epiglottis, that will fold over the trachea and keep food from going in it. But that's the upper airway: nasal cavity, pharynx, larynx, trachea, lungs, bronchial to alveoli. That's all lower respiratory tract. So rhinitis is basically just mostly the common cold, or also known as non-allergenic rhinitis, or you have allergenic rhinitis that a lot of us in Tennessee suffer from. So treatment for rhinitis, and again, rhinitis is just the nose is the rhino, so nose rhinitis, inflammation of the nasal cavity. That's what rhinitis is. Treatment for this is find the cause. Typically, it's going to be viruses, allergies, environmental. What's the cause? And then we treat with antihistamines, corticosteroids, nasal decongestion. So antihistamines are going to kind of block the histamine response, which hopefully reduces local inflammation. Steroids will reduce the swelling as well and capillary permeability. And then nasal decongestions will cause us to lose some of that mucus buildup, hopefully get it out. Um, so typically, again, it's more viral is the common cause of this, and treatment and management is a concern. Need to know from this is that with upper respiratory infections, um, do you think that it's helpful to give someone an antibiotic? Probably not, because these are typically viral. So we can rule that out by doing swabs, doing strep tests in the oral mucosa, that sort of stuff. But if we've ruled out bacterial, then doing an antibiotic does nothing. So that's a good patient education point, because a lot of people think, I feel like crap, I got a cold, give me an antibiotic. But that's the reason that we did that for so long, is that's what we have resistant forms of bacteria now, to resistant to antibiotics. So we have to be very careful about letting colds just run their course. Viruses will usually mutate themselves out within a few days. They have a fast course. So we can't treat with antibiotics because it won't do anything with a viral rhinitis, which is the common cold, basically. Pharyngitis. So this is infection of the back of the throat, basically. This is very painful inflammation. This is what you would call pharyngitis, is your typical sore throat. So it's going to have fiery red throat and tonsils. Tender lymph nodes are possible. Usually there's not so much fever, but there is sore throat, headache, maybe general malaise. With this, it's just recommending people increase their hydration and treat their local symptoms. Again, it's not helpful to give antibiotics for this unless we've done like a strep test and we've determined that the infection for pharyngitis, again, pharyngitis is the name for sore throat, that is like streptococcus is the one doing it, and then antibiotics will help. But again, not always. If it's viral, it's not going to. Peritonsillar abscess. So this would be severe throat, inability to like open the mouth, severe swelling. We may need to drain this. This is usually edematous and fluid filled abscess, or it could be infection based abscess, a little bit more rare. But either way, we'd have to deal with it by draining it, treating the swelling and edema. It's called a peritonsillar abscess, usually on the tonsils, fairly rare. So some of the other laryngitis is the same as the pharyngitis and rhinitis. It is a inflammation specifically of the larynx. This is like, I've lost my voice because the vocal cords are here in the larynx. And so when they're inflamed, the sound waves don't vibrate them effectively. And then you're going to have them hoarse and lose their voice. This could be from infection or overusing our voice like I do often, or so voice abuse, like singers and people that talk a lot, and dust and allergens as well. Managing symptoms, we could treat swelling with steroids if it was too bad. But typically, this is not infection related necessarily as much as it is overuse. So it depends on what the cause is. Again, most all of these depend on the cause. We could treat with antibiotics again if the cause is an infection that's bacterial, but we want to recommend hydration, steroids, antihistamines, possibly depending on the cause, and non-smoking, that sort of thing. For upper airway, you have obstructions. Upper airway obstructions usually lead to some noisy breathing. So this could be like stridor sounding, which is that very like high pitched whine sound, and that's scary. So typically, if you hear that, you hear like very noisy breathing during inhaling, this is usually more close to the top of the trachea. So this is usually upper airway if you hear it during inspiration. So nose, pharynx, larynx. If you hear it during expiration, exhaling, then typically this is in the lower to trachea bronchi obstruction. It just depends. Monitor breathing, airway, identify the cause. If this is an object, a foreign body, that we got to remove it. If it's a tumor, then we have to diagnose it and biopsy it and probably remove it. And then overall, it's just keeping, status. If they need oxygen replacement, looking for use of accessory muscles, or signs of dyspnea or trauma, or signs of difficulty breathing would be what the big monitor is here. Typically upper airway obstructions typically can be food bolus aspiration, so just food or small objects. It could be related to the airway swelling. You'll see a stridor, that sound. Stridor is the name of the sound, but upper airway obstruction could be the croup type of infection seen mostly in young newborns to infants, small children. Epiglottitis could be inflammation or infection surrounding the epiglottis, or typically you're going to see this with like upper airway, severe asthma exacerbations with upper airway anaphylaxis from something like that. And again, it could be a tumor or mass. Laryngectomy, just to know what this is. So the larynx gets removed. It could be a partial laryngectomy or a total laryngectomy, but they're going to lose their voice. Removing the larynx, which is the vocal cord. So if we remove that, we're losing voice, and air. The way our voice works is air passes over the vocal cords, and that's how we create sound. What could happen here? This could be from severe trauma or cancer of the larynx. This could also be done for radiation of cancer of the larynx tends to destroy the larynx, and then we have to remove it. So radiation toxicity basically from treatment. But they're going to have one of those machines they put to kind of create sound through vibrations. You don't see this as often, but that's what it is. It's basically a permanent stoma is created. It's a permanent tracheostomy, basically. It's bypassing the larynx and going directly to the trachea. So a patient has viral rhinitis, and they ask the nurse, "Hey, can I get an antibiotic to help me feel better faster?" Which response by the nurse is most appropriate? Hopefully, excuse me. Hopefully, answer number two. Antibiotics are only effective against bacteria. It's in the name. So this will not help treat your cold. We can treat your symptoms for your cold. You'll have to let it run its course, that kind of thing. This is important for education. This is still an education point for people. So if you're talking about upper respiratory conditions, typically it's related to the common cold, rhinitis, and you want to really make sure you educate patients appropriately. All right, that wraps up chapter 18. So 17, 18. So next we'll move into 19 and 20, which we focus on the lower respiratory infections and diseases. And that's where the meat and potatoes, so to speak, of all the rest of the respiratory stuff comes from. So See you guys in class. Thank you for your time watching. Talk to you later.